Good morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode. If you have questions, please send them to the presenter by using the chat panel. The button to open the panel is usually located in the upper or lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel throughout the presentation. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on VADA's website 30 business days from today. To access the recording and PowerPoint, go to www.vada.org, then to our Resource Center and onto our training library. VADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on VADA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide VADA as a part of registration remains confidential. Statements of credit will be posted 30 business days after the evaluation closes for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close midnight Tuesday, June 13th. Up to 2 general continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are licensed, if you're certified with the Florida Certification Board or a license outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. And now I'd like to introduce our presenter for today, Benjamin Hackworth. He has over 5 years of experience providing community presentations, technical assistance, and trainings on substance use and mental health prevention services. As an independent contractor, he collects, analyzes, and evaluates data for local, state, and national dissemination through written reports and oral presentation. Ben previously contracted with the Center for Substance Abuse Research as a Sentinel Site epidemiologist for the National Drug Early Warning System, funded by the National Institute on Drug Abuse. Ben graduated with the Masters of Public Health from Northwest Ohio Consortium for Public Health, a joint collaboration between the University of Toledo and Bowling Green State University. His specialization is in health promotion and education. And Ben, I will turn this presentation over to you.
Awesome. Thank you, Rebecca. Good morning, everyone. I hope everyone's having a great morning so far. Today, we're going to be going over the patterns of and trends in substance use in Florida. This is the annual report for 2023. The written report will be available on VADA's website soon, probably before the end of the month, for you all to explore and also deep dive into some of the data that we'll be going over today. The slides that I'll be presenting will come from that report, so you can definitely check out the report on VADA's website in the near future as well. The objectives for today's presentation are as follows. I'll be presenting recent substance use trends for youth and adults at national and state level. We hope that you understand patterns in substance use regionally and statewide, and also are able to identify emerging substances use trends. So a little introduction for the annual report. This is an update from the previous annual report update. And if you've been on these webinars with me before, it's truly just an update from the previous webinar and report. And I'll be presenting to you all the latest trends in substance use in Florida. So basically, we're just updating you on different substance use trends and death data throughout Florida. We'll also update you on substance-related deaths from the Florida Medical Examiner's annual report. Some of the data resources that I pulled for this report come from the following. The Center for Disease Control and Prevention utilizes the U.S. drug death data that we'll be going over. I pulled data from the Florida Health Chart sponsored by the Florida Department of Health. They have specific opioid data for Florida. Also, the 2021 annual report from the Florida Medical Examiners Commission. And then the Florida Youth Substance Abuse Survey, otherwise known as FISIS, a survey that assesses risk and protective factors for substance abuse for Florida youth. This survey is administered to Florida middle and high school students in the spring annually. The survey results are for odd number years include state level data only, while even number years include regional and county level data. So I'll be displaying regional data throughout the years while comparing state data in the upcoming slides coming from the FISIS. Also, I should have included the National Survey on Drug Use and Health data on this slide as well, as we'll be going over some of those survey results in the first half of this presentation. So when we talk about the different regions in Florida, I'll be referring to them as managing entities. And it's important to know which managing entity you might all reside in, and where different Florida Department of Children and Families contracts with several regional systems to provide behavioral health services for people throughout the state and throughout these regions. The first region that we'll discuss is the Panhandle, the Northwest Florida Health Network. Although it has one of the largest geographic areas, it's the smallest in population. The next one in yellow shaded is referred to as Lutheran Services of Florida. And then we have Central Florida Behavioral Health Network in red. Central Florida Cares Health Systems, dedicated by orange. And then Southeast Florida Behavioral Health Network in coral pink. There's Broward Behavioral Health Network Coalition in Broward County, and then Thriving Mind South Florida. So all of these different regions are considered as managing entities for DCF. And some of these regions, as you can tell, are have higher population sizes and so forth, and we'll be discussing different rates per population as well in the upcoming slides. So the first substance that we'll be discussing is pain reliever misuse among adults in the US and Florida. This data comes from the National Survey on Drug Use and Health, which I'll just refer to from now on as NSDUH data. So NSDUH state estimates are typically based on 2 years of combined data. However, in 2021, data points are based on single year data due to changes in the survey methodology. And so due to this change in the survey, there's a greater variance around the estimates, meaning that the data points are less consistent, so it's harder to make predictions than for the usual 2-year estimates. So when 2022 data comes out, it'll go back to 2-year averages. So basically, what I'll be discussing is kind of like previous year's data and then 2021 data separately, because due to the changes, it's kind of hard to compare the data. So what we see here from previous years, though, is the prevalence rate has been decreasing for the US, which is indicated by the orange dots, since 2015. And in Florida, it's also been decreasing as well, which is dedicated by the blue dots since about 2017, 2018. And these rates begin to close in at the same rate from 2018, 2019, and between 2019 and 2020 with the same rate at 3.6. And then in 2021 alone, Florida is shown to have a smaller rate at 2.5% of adults 18 and older to misuse pain relievers, while the US had 3.2% of adults 18 and older misusing pain relievers. The survey found no difference in rates among ethnicity or race. However, one thing that they found was hydrocodone was found to be the most commonly misused prescription pain reliever out of the subtypes that they surveyed. When we look at this pain reliever substance use misuse among youth in Florida and the US, we also see a steady decline for misuse from previous years from 2015 to 2020. In 2021 alone, 1.9% or just under 500,000 US youth 12 to 17 misused prescription pain relievers in the past year, while 2.2% of Florida youth 12 to 17 misused prescription pain relievers. So this data comes from FISIS. So the last webinar, if you attended, I showed statewide trend data from 2011 to 2022. And so for this webinar, though, I wanted to highlight the different managing entities. So here we have lifetime and past 30-day pain reliever misuse among Florida youth for only 2022. So in blue represents the 30-day survey results, and in orange represents the lifetime use results for each managing entity, and then also for the state in the last column. So the highest rate for 30-day use was among the Lutheran Services Florida and Central Florida Behavioral Health Network, while the lowest for 30-day use was in Broward Behavioral Health Coalition. 2.1% of lifetime use was the lowest reported rate among 3 managing entities in the middle here, and 3.5% was the highest rate for lifetime use in the Lutheran Services Florida region. The next substance we'll talk about is heroin use. Again, this is from the NSDUH survey results. The US has had higher rates of heroin misuse when compared to Florida. In 2021, though, 0.32% of those 18 and older in Florida indicated heroin use in the past year versus 0.43% misusing heroin in the past year throughout the US. Among people 12 and older in 2021, 0.4 or about 1.1 million people misused heroin, and that percentage was even higher among those 26 and older. Heroin misuse among youth is shown here for the US and Florida. We see from previous years that the rate has been declining rapidly, and in the past two survey cycles, the rates are so low that the calculations are not sufficient with precision to be presented on, and so they are labeled as 0%. But you can see how in previous survey years, how dramatically the rate has decreased to those low numbers. And these low numbers also are indicated from the physis in Florida for lifetime and past 30-day use for heroin among Florida youth was seen pretty evenly across all managing entities. For 30-day use, 0.1 to 0.2% was reported, and 0.3 to 0.5% was reported for lifetime use. So these are pretty low numbers. So heroin is not a common substance for youth. The next substance will be cocaine misuse among adults in the US and Florida. The rates are slightly higher compared to other substances here. In 2021, almost 5 million people in the US used cocaine in the past year. The percentage was highest among young adults aged 18 to 25. And cocaine use in the past year among people aged 12 or older did not differ among racial or ethnic groups. However, Black people were more likely to use crack in the past year compared to other races / ethnicities, according to the survey. When we look at cocaine use among youth in Florida and the US, we see that in previous years, cocaine use among youth has decreased across the US and in Florida. And new study results show very low past year use among those 12 to 17, with only 0.13% of youth in Florida using cocaine, and then 0.15% of US youth using cocaine in the past year. Looking at the physis data for 2022 again, managing entities that had over 1% of lifetime use for cocaine was found in the Northwest Florida Health Network and Central Florida Behavioral Health Network regions. The lowest rates of lifetime and past 30-day use was found in Thriving Mind South Florida and Broward Behavioral Health Coalition, which was indicated as 0%. Methamphetamine misuse among adults in the US and Florida is shown here. Before the 2021 survey results, methamphetamine misuse among adults in the US and Florida had been increasing throughout the time span that you can see here from 2015 to 2020. In the US, just under 1% or 2.5 million people 12 and older used methamphetamine in the past year in 2021. Percentages were highest among adults aged 26 or older. And as far as race or ethnicity, those who identified as multiracial had the highest rate, followed by white people. Methamphetamine use among youth in the US and Florida is shown here. Youth 12 to 17 had the lowest estimate of past year meth use among all other age groups, with just 0.1% of those 12 to 17, or about 37,000 people throughout the US, misuse methamphetamine. As far as lifetime and past 30-day use of methamphetamine, it's relatively low as well, with 1% of lifetime use as the highest rate in the Northwest Florida Behavioral Health Network. So methamphetamine among youth is not common either. Some more common substances that we're used to seeing more with survey results and higher prevalence rates include past year marijuana use among adults in the US and Florida. And as you can see here, in previous survey results, there was an increasing trend from 2015 to 2020. Looking at 2021 alone, 19.5% of people in the US 18 and older misused marijuana in the past year, while 15.4% of adults misused marijuana in Florida. Of the different age groups, 18 to 25-year-olds had the highest rate of use compared to other age groups. So we just looked at past year use among adults, and now we'll look at past month marijuana use among adults. Again, we see a similar pattern from the previous slide, whereas adults in the US and Florida have seen an increase in past month marijuana use from the previous survey years from 2015 to 2020. In 2021, 13.7% of US and 11.2% of Florida adults 18 and older used marijuana in the past month. The highest use was among young adults aged 18 to 25, followed by adults aged 26 or older. Looking at a wider lens, for those 12 and older, 13% of that misused marijuana in the past month also used a vape to misuse marijuana. So of the 13%, 2.7% also vaped marijuana. The highest amount of use, again, for those who misused marijuana and also vaped marijuana, was among those who are 18 to 25. So this age range, 18 to 25-year-olds have the highest rates for misusing marijuana. Now we'll look at past year marijuana use among youth, 12 to 17. Unlike the trends that we see from the adults from the past two slides, In the US and Florida, youth rates have been declining according to the previous survey years. And in 2021, 10.4% of US youth misused marijuana in the past year, while 9.3% of Florida youth misused marijuana in the past year. For past month marijuana use among youth in the US and Florida, it's much like the previous slide with a slight decline. Has a slower rate of decline compared to past year use. When we look at the previous year survey years, in 2021 though, 5.7% of US youth misused marijuana in the past month, while 3.9% of Florida youth misused marijuana in the past month. According to the FICIS data, lifetime and past 30-day use of marijuana decreased across the state in 2022. Among the managing entities, Lutheran Services Florida had the highest rates for lifetime and past 30-day use with 18.3% and 9.6% respectively. The lowest rates were found in Broward Behavioral Health Coalition region at 9.8% and 3.9% respectively. One good thing about the FICIS is that they capture vaping data, and they were able to separate whether youth were vaping nicotine or whether they were vaping marijuana. Vaping nicotine is much more prevalent among youth in Florida. And also a new study from the CDC and FDA indicated that in 2022, more than 2.5 million middle and high school students across the US reported the use of e-cigarettes in general. So this is becoming or has been a very common substance among youth across the US and Florida. It's mostly across the board second most common substance after alcohol. And you can see here the lifetime and past 30-day vaping nicotine rates across the managing entities. The highest rate was 24% for lifetime use, and also the highest rate for past 30-day use was 11.9% in the Northwest Florida Health Network for both of those percentages. Females actually reported higher use for vaping nicotine in Florida, and the highest rate when we compare race and ethnicity throughout the state was among white non-Hispanic students. And then looking at the FICIS data for vaping marijuana, again, we have slightly lower rates when compared to vaping nicotine. So it's not as common, but still we have pretty high rates. And the highest rates for lifetime and 30-day use for vaping marijuana, again, was seen in the Northwest Florida region, and also Lutheran Services managing entity regions as well. The lowest rates were found among Broward Behavioral Health Coalition, as you see here, at 7.3% and 3.1% for 30-day use. Vaping marijuana was also found highest for use among females throughout the state, and also was found to be highest among white students throughout the state. Now, the more common substance for adults and youth is alcohol use. And in 2021, people age 18 or older in the US, around 53% drank alcohol in the past month, and in Florida, around 51% drank alcohol in the past month. When we look at the survey results and compared demographics, white people had higher percentage of use than other racial or ethnic groups. Asian people had some of the lowest estimates for alcohol use among adults. We can look at binge drinking among adults throughout the US and Florida as well. There are about 23.2% of binge drinkers in the US, which is just over 60 million people, and about 21.7% of binge drinkers in Florida in 2021. The percentages were highest among adults age 18 to 25. So that age range was seen to have the highest rates, the prevalence rates for binge drinking, which of course this is college age students. Past month alcohol use among youth. According to the NSDUH data as shown here, past month alcohol use among youth was at 6.9% in the US and 6.6% in Florida. From the FISIS data, again, this is the most commonly used substance among Florida youth. Rates are distributed pretty evenly across all managing entities for lifetime and past 30-day use, except for Southeast Florida Behavioral Health Network and Broward Behavioral Health Network, as these two have some of the lowest rates in comparison. Looking at demographics from the survey, females have a higher rate of alcohol use versus males, and white non-Hispanic students also had higher rates compared to their counterparts. Binge alcohol use among youth was also captured from the NSDUH data, and binge drinking among youth in the US was at 3.8% and in Florida at 3.1%. We see a slight decrease from the previous survey results as well. So the FISIS captures binge alcohol survey results as well. In the survey, it defines binge drinking as having had 5 or more alcoholic drinks in a row in the past 2 weeks. And so with this specific definition, the results are shown here. And the region with the highest rate was the Northwest Florida Health Network managing entity at 7.1%. And the lowest was 3.2% in the Broward Behavioral Health Network region. Rates of use was higher, again, among females versus males, and then highest among white non-Hispanic students again. Some other substances that the FISIS data captures for lifetime and past 30-day use is substances such as inhalant use. Inhalants include volatile solvents, aerosols, different gases, and nitrates. And these are all spelled out in the VICES survey for the middle and high school students to know what specifically they're referring to with specific examples of what an inhalant is. And so from this graph, you see here from the FICES, we have higher percentage of lifetime use for this substance compared to other substances within the survey, such as heroin, cocaine, methamphetamine. So this is actually, we have higher percentages here compared to some of those other substances. And the highest rates for lifetime and past 30-day use were found in the Lutheran Services Florida region, with 2% of youth using in the past 30 days and 6.3% of youth using in their lifetime. According to the NSDUH, respondents from the survey were asked to report the use of inhalants to get high in 2021, and 0.8% of people aged 12 and older used inhalants. The highest rates was among adolescents 12 to 17. About 2.4% of these percentages decreased by age. So again, inhalant use is pretty common among youth versus adults. They also found no difference among racial or ethnic groups for inhalant use for people aged 12 or older. The next substance that the FICES highlights is club drug use, and they define club drugs such as ecstasy, GHB, ketamine, rohypnol, and these substances were found highest in the Northwest region for lifetime use, and was one of the highest for past 30-day use was in Central Florida Behavioral Health Network as well. So those are some of the misuse and like current either past year or past month substance use that we have from the FICES or NSDUH data. And now we're going to move into the overdose death rates for different substances. And we'll look at the US and Florida death rate for overdoses. So in 2021, 106,000 drug overdose deaths occurred, resulting in an age-adjusted rate of 32.4 per 100,000 population in the US, which is shown in blue here. This is a 14% increase in overdose deaths from 2020. Adults aged 65 and older had the largest percentage increase in rates from 2020 through to 2021. The age group with the highest rate in 2021 for overdose death rates was among those 35 to 44 years of age. In 2021, drug overdose death rates increased for each race except non-Hispanic Asian people between 2020 and 2021. And in 2021, the rate of drug overdose deaths, including synthetic opioids, increased by 22%, while rates of deaths involving heroin declined by 32%. So we'll see these numbers similar. We'll see a similar trend with these numbers when I show you the Florida specific data, where we're seeing synthetic opioids such as fentanyl increase, and we're actually seeing a decline in heroin use or deaths from heroin. Rates of drug overdose deaths increased for deaths involving cocaine and psychostimulants like methamphetamine, which also is a similar trend in Florida. And the age-adjusted rate for males increased by 14%, while the rate for females increased by 15% from 2020 to 2021. Although overall, the drug overdose deaths is highest among males. So, unfortunately, with the graph here, we are still seeing an increase in drug overdose death rates and just an overall increase in overdoses in the US and in Florida. So again, we saw a 14% increase in the US, and then in Florida, we have a higher death rate than the US, which in 2021 was at 37.5 per 100,000 population versus 35 per 100,000 population in 2020. When we look at fatal overdose deaths, drug deaths in Florida, we can see in this graph that, again, we're seeing an increase in overdose drug deaths in Florida. And this data comes from the Florida Health Charts, sponsored by the Florida Department of Health. And these are overall the number of fatal drug overdoses in Florida throughout the years. So as we can see, total drug overdose deaths in Florida began increasing in 2015 throughout 2017 until we saw a decrease observed in 2018 with just under 5,000 fatal overdose drug deaths. However, since then, we've seen increases continuously, with the highest percentage of increase between 2019 and 2020, and then another increase from 2020 to 2021, with just over 8,000 drug overdose deaths in Florida. We can separate the previous chart from overall drug deaths to fatal opioid overdose deaths. And opioids remain the most common cause of death among fatal drug poisonings across the state and the nation. And these patterns and trends overall are largely driven by opioids such as fentanyl. In Florida, the increasing number of fatal opioid overdose deaths mirror the same trend from the previous slide. And so we see, again, the increase starting in 2015 with 2,500 fatal opioid overdose deaths, increasing all the way to 2017, and then a slight decrease in 2018, but then increasing since then. And the biggest increase, again, just like the previous slide, was seen between 2019 to 2020. And in 2021, we found another slight increase in fatal opioid overdose deaths with 6,442 overdose deaths in Florida. We can, in the US, drug overdose deaths involving natural or semi-synthetic opioids such as oxycodone and hydrocodone have remained stable at a death rate of 4.0 in 2021. And in Florida, prescription opioid-related deaths have remained stable as well. The Florida Medical Examiners Commission specifically outlines 3 prescription opioids. They are oxycodone, hydrocodone, and methadone in their drug report. There are more oxycodone-related deaths compared to the other 2 prescription opioids. However, all 3 prescription opioids are shown here in the graph and are separated by each managing entity. And so, again, this goes back to the graph at the beginning of this presentation. So, Central Florida Behavioral Health Network, in the next couple slides, is always going to have a higher number of occurrences for these substances that we'll be talking about. But I'll go over the rate per 100,000 population to kind of give a different perspective. It has the highest or lowest numbers seen. And so when we look at the total number of occurrences, this is the total number of substances that caused the death or were present at the time of death. And so the total number of occurrences, the highest was seen again in Central Florida Behavioral Health Network with just under 700 occurrences. And some of the lowest total numbers were found in Thriving Mind, South Florida, and Broward Behavioral Health Coalition. However, like I said, based on rate per 100,000 population, Thriving Mind, South Florida had the lowest rate at 3.8 per 100,000 population, while the highest rate was in the Northwest Florida Health Network at 11.9 rate per 100,000 population. The next substance that we'll go over is heroin-related deaths in Florida. As we see here, we see pretty low rates starting in 2011, and then the increase all the way up in 2016, 2017 with over 1,000 heroin-related deaths. And then since have seen somewhat of a decrease, and the highest rate of downfall that we've seen here is in recent years from 2020 to 2021 with only 464 heroin-related deaths in Florida captured in 2021. This also mirrors the heroin-related deaths throughout the U.S. As I said before, heroin has decreased by 32% from 4.1 rate per 100,000 population in 2020 to 2.8% in 2021 throughout the U.S. When we look at heroin-related deaths in Florida, throughout the managing entities, we see here that, again, Central Florida Behavioral Health Network has the highest total number of occurrences, whether it be deaths that were caused or present at the time of death. And then some of the lowest rates in Central Florida Cares Health System and Thriving Mind South Florida for total number of occurrences. Based on rate per 100,000 population, the Broward Behavioral Health Coalition region and Northwest Florida Health Network region both had a rate of 3.7, the highest rate of heroin-related deaths among all the managing entities in Florida. The lowest rate for heroin-related deaths was seen in the Thriving Mind South Florida region at just 0.7 rate per 100,000 population. The next substance is cocaine-related deaths in Florida. In the US, deaths including cocaine has been rising since 2012. The rate in 2021 was 22% higher than the rate in 2020. Fatal drug poisonings due to stimulants are also increasing in Florida, experiencing pretty similar parallel rise with the US for both cocaine and psychostimulants like methamphetamine. The rates of cocaine-caused deaths in Florida, although have been consistently higher than the US, although Florida did see a decrease in deaths from 2017 to 2018 that did not occur nationally. Cocaine-related deaths in Florida slightly increased in 2019, but then sharply increased in 2020. And in addition, another increase in cocaine deaths occurred in 2020, with 4,015 cocaine-related deaths in Florida shown here. Among the managing entities, cocaine-related deaths had the highest total number of occurrences in Central Florida Behavioral Health Network and the lowest in Northwest Florida Health Network. Based on rate per 100,000 population, the highest cocaine-related death rate in Florida was in the Broward Behavioral Health Coalition region with 25.1 rate per 100,000 population. And the lowest cocaine-related death rate was in the Northwest Florida Health Network region with 10.9 rate per 100,000 population. And this is pretty common for these regions to have the highest and lowest cocaine-related deaths. South Florida is pretty notorious for cocaine-related deaths and misuse, whereas it's not as common in the panhandle of Florida. So a little bit of history there. Let's see. I think before we move on to the next substance, I think I'll turn it over to Rebecca to see if we can do a break.
Absolutely. All right, everyone. We will meet back here right at 10 o'clock. Thank you all. I will put the time to return from the break in the chat as well. Hey everyone, welcome to today's webinar. We are going to pick up right where we left off. Thank you all for joining us. I hope you had a nice break. And now I will turn it back over to Ben.
All right, thank you. I'll address some of the questions first before we move on in the chat that I was looking up. Okay, so let's see. I saw something about club drug use and whether or not it was what the trend was throughout the state. And according to the FICIS, it actually decreased in 2022. So in 2018, it was 1.3% of Florida youth using club drug use in their lifetime. And then it increased in 2020 at 1.5%, but then decreased, like I said, to 1% in 2022. Similar rates occurred for past 30-day use for club drug use. So in 2018, it was 0.4%. It increased in 2020 to 0.5% and then decreased again in 2020 to 0.4%. So we're seeing a slight uptick, but in recent survey years, it's club drug use has decreased for both lifetime and past 30-day use. I saw someone asked about the definition for a binge alcohol use. For the FICIS, it's they typically define it as having 5 or more alcoholic drinks in a row in the past 2 weeks. As far as the NSDUH data, which surveys the US and Florida, they define it as binge alcohol use is defined as drinking 5 or more drinks for males and 4 or more drinks for females on the same occasion on at least one day in the past 30 days. So that's how they, so 2 separate surveys define binge drinking. Let's see what other questions I saw. A lot of people are asking about fentanyl and is it being mixed with cocaine? And the answer is a definite yes. There's fentanyl being mixed in literally every substance, which we'll talk more about some different emerging trends and the use with fentanyl. But yeah, some of these increases that we're seeing in different substances like cocaine throughout Florida, methamphetamine as well that we'll see in the next slides. These are all definitely contributing from fentanyl being mixed into these substances. Also, the potency is just increasing as well. And according to the 2021 annual report from the Florida Medical Examiner's report, which that's what this slide shows is just 2021 data only. The report is actually really interesting to look at if you want to explore more into detail about each substance. And they have a separate column for example, deaths with cocaine only and deaths with cocaine in combination with other drugs. They don't specifically say if it's fentanyl or not, but that's most likely the case for what we're seeing right now in this epidemic. And so, for example, like in this slide, I told you that there were the total number of occurrences, which is the number of caused deaths and the number of cocaine present at the time of death was a total of 4,015 cocaine-related deaths. And of those, 3,500 were in combination with other drugs. So there's other drugs being, so polysubstance use is basically being used across the board, and we're seeing from reports from different data sources that fentanyl is most likely the cause of these different increases. And so, yeah, we'll look at more information. And yes, I just saw someone put something about the pandemic. I mean, the the issues that we had with the pandemic was, an increase in supply and again, increase in potency with across the board with substances. And, we were in a lockdown. We weren't able to get, people who use substances weren't able to get the supplies or the help that they needed, um, people who need addiction services, they weren't able to get the help that they needed, and it just caused like this huge effect that I'm sure all of you have unfortunately had to experience with your expertise in your fields. Um, but yeah, so unfortunately, the the fentanyl is definitely causing an increase and being mixed with a lot of these substances that we'll be continue to discuss. Um, okay, so to go back to where we were, the next substance that we'll discuss in relation to the Florida Medical Examiner's data is methamphetamine. And methamphetamine is becoming a huge issue across the US, but also in Florida. Um, in 2021, the rate of drug overdose deaths involving methamphetamine was 33% higher in 2021 than the rate was in 2020 throughout the US. And in Florida, we obviously see another huge increase from 2020 to 2021. um, the number of methamphetamine related deaths has dramatically increased every single year since 2016. And the biggest jump that we see was actually occurring in 2021. So we went from 2,080 methamphetamine related deaths to just shy of 3,000 methamphetamine related deaths in Florida. As far as the breakdown among the managing entities, um, we see some higher rates in the first three columns, and these regions are in the north and central parts of Florida. And kind of with the history of cocaine being more common in the South, methamphetamine is more common, misused and abused in the Northwest Panhandle and also Central Florida. And based on rate per 100,000 population, the highest rate for methamphetamine related deaths among the managing entities was found in the Northwest Florida Health Network region at 27.2 rate per 100,000 population. And the region managed by Thriving Minds South Florida had the lowest methamphetamine related death rate at only 2.7 per 100,000 population. And then finally, we can discuss fentanyl and fentanyl analog related deaths in Florida. And so this is as we all know, the driving force in the current opioid epidemic. and what we're currently experiencing with synthetic fentanyl in this third wave of the opioid epidemic. I combined fentanyl and fentanyl analogs since there's so many analogs out there and they're constantly being pushed out into the drug supply. So combining these related deaths is shown here throughout the state from 2011 to 2021. So the rate started increasing in 2015 at 911 related deaths for fentanyl and fentanyl analogs. And then the increase, as shown even in previous substances, started increasing in 2018 and has continued to increase. The biggest increase was between 2019 and 2020, as we see the big jump of almost an additional 2,000 deaths. And then in 2021, there were 9,218 fentanyl and fentanyl analog related deaths in Florida. With the medical examiner's data as well, looking at the separate columns, the amount of other drugs that are used in combination is like 98%. So people aren't only using fentanyl, they're using fentanyl with other substances, and this may be intentional. It's probably unintentional though. But just to spew off some numbers from their report, yeah, it's 98%. I think it's 98% of fentanyl is used with other substances. So again, the user may or may not know if they're using fentanyl or not. A lot of it is broken down and adulterated into different substances, either to add weight to the drug supply or yeah, there's all different reasons for fentanyl being added to the drug supply. So we're definitely seeing an increase in the supply and the potency of fentanyl, not just in Florida, but throughout the US. When we look at the managing entities from the medical examiner's report in 2021, we see the different distribution here with the number of occurrences for Central Florida Behavioral Health Network having the highest number of occurrences. Again, this is the biggest population region though, and some of the lowest total occurrences occurring in Thriving Mind, South Florida. However, when we look at the rate per 100,000 population, the Broward Behavioral Health Coalition region has the highest rate for fentanyl and fentanyl analog related deaths, with a death rate of 56.8 per 100,000 population. The lowest fentanyl and fentanyl analog related death rate was seen in Thriving Mind, South Florida at 19.4. So even two regions that border each other, they're seeing huge differences in fentanyl and fentanyl analog related deaths per 100,000 population. So now we're going to turn to, so we talked about misuse, survey data, current use, past year use. We discussed kind of like the opioid epidemic trends, the death rates and so forth, and then kind of some up and coming emerging substances that you may or may not have heard of or seen in your work everyday life. So the first emerging substance that we'll discuss is xylazine. So xylazine is a veterinary tranquilizer to relieve pain in animals. When cooked down to a powder, this drug can be added to the drug supply, such as heroin, fentanyl, and even cocaine. Injection use is most common and can be intentional or accidental to prolong drug effects. So a lot of users like it's from qualitative research, they're finding that users kind of like the xylazine because it prolongs the dopamine effect of fentanyl. And, however, some people may or may not know that it's being added to their drug supply, though. It's also been known to cause skin ulcers and abscesses, which can ultimately lead to amputations if not treated early. Since it's not an opioid, naloxone in some overdose cases can be compromised. And the xylazine epicenter began in Philadelphia, but has now made it throughout the US and even Florida. Um, so, although it's not required to report xylazine occurrences for the Medical Examiners Commission report, several districts throughout Florida have reported xylazine occurrences in 2020 and 2021. So just in comparison, in 2020, there were 99 reported xylazine occurrences, but in 2021, there were 236 occurrences of xylazine reported throughout the state. And so this overall, just between 1 year, is a 138% increase. Again, it's not required to report out, but this is just a new and emerging substance that we're seeing, and we're seeing a lot more occurrences of xylazine throughout Florida. So it's also been kind of given the name of the zombie drug. Like, I don't know if anyone's seen videos of people like bent over after using this combination of fentanyl and xylazine. But that's kind of like the physical effects as well after using. So this is a really big issue, and health departments and the medical examiner need to be aware of the more and more xylazine that is being used throughout the state. The next emerging substance that we'll discuss is benzodope. Benzodope is co-abusing illicit benzodiazepines with opioids, most commonly used with fentanyl. The illicit benzodiazepine supply has increased in the US since 2019, and 92.7% of benzodiazepine involved deaths also involved opioids for the first half of 2020. So we're seeing a lot of new illicit benzodiazepines on the drug scene and the drug supplies, and we're seeing a huge increase in co-abusing these illicit benzos and fentanyl as well. So basically, the co-abuse of both these substances, they increase your risk for overdose because both substances cause sedation and decrease your breathing. So it's another dangerous combination of new drugs and kind of a new trend that's being discussed a lot within the US and Florida. The last emerging substance that's been popping up in the news is called gas station heroin. So gas station heroin was given the name for how easy it is to find, whether it's purchased online at convenience stores or even gas stations. So this drug, tiantine, excuse me for trying to figure this out at this early in the morning. So this substance is being sold at gas stations, and it's more of an antidepressant, but it can impact like in an opioid. So it has opioid-like properties in its use. It's marketed as a dietary supplement, and it's not. It's unfortunately unregulated right now, and a lot of these pills that you can buy are unregulated by the US FDA, although they do warn about how it can be harmful and addictive. So this is another kind of new emerging substance that's kind of getting its name around in the news cycles. So those are some emerging substances. And then just to recap everything that we've talked about today, some of the highlights are seen here. Alcohol use among US and Florida youth and adults has decreased. Marijuana use among US and Florida adults have increased, while marijuana use among US and Florida youth have decreased over time. Vaping, nicotine, and marijuana remains steady with a slight decrease in overall rates for Florida youth, according to the recent FISA survey. However, vaping nicotine is still a top substance for youth nationally. And then when we look at deaths from different substances, fentanyl, methamphetamine, and cocaine-related deaths continue to increase throughout Florida and the US as well, while heroin-related deaths decrease in Florida and the US. And then lastly, these emerging substances pose a threat to drug users and the drug supply. So some of the resources from today's presentation are from the following: Centers for Disease Control and Prevention, Florida Department of Children and Families, the Florida Health Charts, NSDUH, and FISIS. And then also my references again. In addition, the Florida Medical Examiners Commission 2021 annual report. And lastly, this is my contact information. If you have any additional questions about this presentation or about any substance use that you want to know more of throughout the state of Florida. So I'm going to give it back to Rebecca, and thank you all for your participation, and I love these questions. I'll make sure to try and answer the best I can, and thank you so much for your attention.
Well, thank you so much, Ben. I appreciate all the work you put into this, as well as I know everybody else on participated in it and appreciated it and was enjoying it this morning. Thank you for meeting us. I know it's super early on your time. So for everyone, we have a couple of items of business before we conclude today's webinar. Please see the chat panel for a link to today's survey. Let me switch over to me. Sorry, everyone. Come back to myself here. All right, there we go. All right, once again, Ben's information is here. If you would like to contact him, I will leave it for just a few moments just so y'all can look at it, write it down, whatever you need to do. And we are going to pick up again So today there is a link to the chat to the survey. You'll be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department license prefix and number when you registered for this webinar. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for this webinar as what you have set up in your FATA profile, as this is the only way to connect your attendance. You will get a second opportunity to complete the evaluation through a follow-up email later today. Please remember the evaluation will close Tuesday, June 13th at midnight. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation closes. Thank you all for participating in today's webinar. We'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Thank you all and have a great rest of your day.